Thank you, Madam Chair. First, I want to thank the Biden administration for increasing Florida's weekly allocation 16% from 300 up from 266,000 to 307,000 for our weekly allotment. That's key. I want to thank our colleagues who supported the COVID-19 relief so far. FEMA just awarded 245 million to our state to pay for 100% of vaccine costs for the next 90 days. But we need to keep it up. Florida's 25th per capita in vaccinations, and we need the help. 2 million shots in arms and counting. I do want to set the record straight. Pfizer was the first vaccine approved. It was approved on December 11th, 2020. It was not part of Operation Warp Speed. I'm going to repeat that. Pfizer was not part of Operation Warp Speed, so it's really important to keep the record corrected. The real lesson, I think, is we've had bipartisan support for NIH funding for years, and that created the health technology for making these new vaccines, like with Pfizer, like with Moderna eventually. Really important for us to make sure that record's clear. And outreach is critical, particularly in rural communities, many of them rural Anglo communities in my district, as well as communities of color. We know the history of distrust. It was mentioned briefly, but it's important to discuss. The federal government last century deliberately infected Black men with syphilis in the Tuskegee experiment. It sterilized Puerto Rican women during the 30s and 40s. So we know that this distrust is there from history, which is all the more reason why each of us, members of Congress, need to work with the bipartisan effort with the Biden administration to do our own outreach. Local hospitals in Central Florida, such as Advent Health, Orlando Health, and Baycare, Osceola Regional, have given me a list of concerns. Hospitals from Central Florida, like retaining and recruiting expert nurses, concerns of mental health for healthcare workers, patient Medicare admission criteria for nursing and ALF patients, and citizens in rural areas and communities of color. We see retail sites like Publix that are doing their best, but it's not present in every community across Florida. So we've seen uneven allocations, like in East Polk County. Local African-American cities have been left behind. In Osceola County, a majority Hispanic county has been left behind in allocations. So I look forward to working with Biden's Equity Task Force. I want to first ask Dr. Khaldun, in your testimony, you state we cannot simply assume our existing healthcare workforce, many of you have been working nonstop, will have enough for this massive undertaking. Dr. Khaldun, what does your state need for the federal government to help address these workforce issues?
Right. So one thing I'd say, and thank you for that question, one thing I'd say is that I'm incredibly grateful for the support of the Michigan National Guard. They have been partners throughout this pandemic, supporting us with testing and now with our vaccination efforts across the state. I think we also need to bring in more community vaccinators. We need to be using clinical students, and that's what we're working on as well, just like Dr. Marsh from West Virginia. So those are the types of things that we are working on to be able to support our healthcare workforce.
And Dr. Ezike, we know you've mentioned workforce capacity challenges. How are you addressing those challenges, and how can Congress help you with these workforce issues?
Yes, thank you. So we are expanding the pool, as my esteemed colleagues have mentioned. We've increased the ability to vaccinate to EMTs, emergency medical technicians. We're working to expand it to, we have for pharmacists, of course. We're looking to put phlebotomists in this as well. Dentists can be part of so we're trying to use as many vaccinators, and we're looking even at our partners in other countries that are just doing just-in-time trainings and trying to bring even non-healthcare professionals and see if that is a possibility under direct supervision. So we do need the ability to expand training programs, that we might be able to have no limitation on the number of vaccinators and then just be waiting for vaccine.
Thank you. And we saw President Biden bringing up the National Guard, enlisting FEMA, 100% reimbursement, 100 vaccination sites throughout the nation. Dr. Phillips, will this additional workforce help Louisiana's COVID-19 program? And what other resources will you all need to make sure your residents are eligible for the vaccine?
I think, as mentioned, the National Guard has been a critical partner here in Louisiana from the start to the end. As we face COVID, we also faced several hurricanes this past year, and they were lockstep with us as we went about those efforts. And the 100% funding is going to be critical that continues. They are our logistical arm, our planning force, and our operational specs on the ground. And so having that has been extremely critical. The other thing that's helpful is that 100% FEMA funding, which will allow us to tap into those community mobile strike teams that are able to go into underserved communities using our social vulnerability index tool. Those are going to be important to have the funding to be able to support the needs that we've identified, in addition to volunteers who are retired clinical workers. They've already mentioned students and faculty of allied health schools, looking at our first responders, including EMT and fire personnel, making sure we have access to all available individuals who are medically trained to be able to provide a vaccine, and that flexibility. As we learn more, we may have to adjust to what we need to do, and having the guidance and the funding to be able to support that flexibility is going to be critical.
Thank you. My time's expired.